Shukran. My name is Sadat. I'm an osteopathic physician. I would like to give you some history of what this medicine is. In the United States, we have two fully licensed types of physicians. We have MDs, such as you know, and many of you are, and we have osteopaths, such as myself, also trained in medicine, also trained in surgery, and something else. So I want to give you a little bit of history of osteopathic medicine. Today, it's quite popular to talk about different styles of manipulation, which is how Dr. Ahmed Hamdemar and I know each other, through physical therapy. There's many physical types of manipulation that became popular through osteopathic medicine, and people have taken these pieces out to use them for different types of healing. So some of these words, craniosacral manipulation, myofascial manipulation, adjustment, these are popular in the physical therapy fields. In my country where I come from, these manipulations are part of medicine. They are part of drugs and surgery. It is another alternative we have. So I want to give you a little bit of the history of how this began. In the United States, this started in the late 1800s from an MD named Andrew Taylor Still. His history, he was born in 1828, and we had a civil war between in our country, as many countries have had, where we went to war with each other. And during that war, he was an MD surgeon. At that time, the medicines were mostly poisons, or we call them snake oil. If you give somebody something that is snake oil from a snake, it means it doesn't really work. You tell them it cures cancer, it fixes your headache, it fixes everything. Well, many of the medicines back in that time were either poisons or they were addictive narcotics. Dr. Still had 3 children, had several children that died of meningitis, and he had a brother that was hooked on morphine, which was called laudanum in the day. This was a man whose life was utterly destroyed, yet he was a spiritual person. Not a Muslim, but he was someone who still felt that there was something good that could come. And he studied these techniques of manipulation by studying anatomy and physiology. And after a number of years, he decided to give it a name. And he said, what I'm doing is called osteopathy. It's perhaps a bad name, because when I went through medical school, I would tell people I'm an osteopath. They would say, are you a bone doctor? Because it sounds like orthopedic. In the United States, you can be an osteopath, orthopedist, you can be an osteopath, neurosurgeon. We're the same as the MDs. We are licensed the same. We work in the same hospitals. We work in the same offices. But some of us also do manipulation. So he founded a school traveled around, and died in 1917. That's in America. In outside of America, there was a man named John Littlejohn. If you come into the word osteopathy from Europe or most other places, they will trace their beginnings back to this man. John Littlejohn was this man right here. He came from Ireland. He became a student of Dr. Still. Dr. Still treated him for some kind of throat condition. We don't really know what it was. He opened up another school in Chicago in 1900. And then in 1917, he went back to England and opened up the British School of Osteopathy. The history is important because many of you, if the term osteopathy, I'm finding as I'm in the Middle East, is a new term. A lot of people don't know what we are. And it is more likely that you will run into someone who's trained from Europe or Canada or someplace like that where it is not medicine, it is, they do not have medical training. But they do manipulation. So we do many similar manipulations. There are some differences between what Dr. Still did and what Dr. Littlejohn did after him. Dr. Still's approach to the human body was that it was this wonderful, spiritual, divine machine. and it was capable of its own healing. This is how I feel. I feel that we were divinely created with the ability to be well. Little John viewed the body more as a set of mechanics and protocols, and I think they're okay. But he had protocols for this disease, you do this thing. We have some common philosophies that all osteopaths share, and that is, first we see the body as a unit. The body is one functioning, perfect unit. I would joke with my patients in my practice in the United States, if I have to send someone for surgery and they need this hand operated on, I say, please go to the doctor who does the right hand. Don't go to the doctor that does the left hand. Because our medicine has become, in our country, so specialized that one doctor, I shared something interesting. I don't remember who discussed this with me. They said, in the West, you have a team approach to medicine. Oh, it was the neurosurgeon who came to the course. Yes, he said, in the West, you have a team approach to medicine. A team gets together and decides things. And I said, I'm not sure what television show you're watching. We're not doing that. Maybe for Bill Gates, he has a team of doctors in hospitals. But for average people, they're seeing many doctors, but they're not talking to each other. There's not some cohesive plan. There's a lot of disorganization. So this is a philosophy, but it makes a difference if I approach the patient medically, surgically, and for manipulation. If I see their body as one whole unit that should function with a set of subparts. Your shoulder problem may not just be shoulder problem. Your liver disease may recruit other body structures to be problematic. The second philosophy is that structure and function have a relationship. From a manipulation point of view, if your back is, if you have a chronic backache, I don't see that as only a chronic back problem. The structure of the back, the nerves of the back have to be reasonably healthy. If they're reasonably unhealthy for a period of time, that structure is going to make the nerves in your intestines a bit upset. By our own statistic, the American Medical Association, we estimate 1 in 4 or 1 in 5 American adults has irritable bowel. You can't have a chronic back pain and probably have normal bowels. So we try and look for the relationship between structure and function. And the third principle, and it's very important, is that the body possesses its own mechanisms to repair and to restore health. And if I can use either drugs or surgery, or in my case, I'm using mostly manipulation. I'm not saying manipulation is replacing medicine either. Manipulation works with medicine. It's an alternative. If I can do something to get your blood flowing, your lymphatic fluid flowing, ease your muscle tension, what is in your body will be able to function better. That's what I'm saying. There's a set of early techniques that we associate with osteopathy and beyond osteopathy. We saw generalized types of treatments where you just start manipulating everything in the body, hoping it gets well. There are styles of osteopathy where they do specific treatment. You say, my shoulder hurts, will you just work on your shoulder? I must note to you, when I was in medical school, one of my professors, he was a very old guy, very little guy, and I was in Florida, which is in the south of the United States, and I'm from Philadelphia, which is near New York City. And my teacher, who I had a very good relationship with, he called me Stevie. Stevie is like for a little boy, so don't call me Stevie, please. He said, Stevie, if you ever get to New York City, I want you to go to the Metropolitan Museum of Art. New York City has a very famous exhibit. And he said, there's an Egyptian exhibit there, and I want you to see it. And what he wanted me to see, and I saw it years later, was in one of the exhibits, I don't know which royal remains these were, but it was some pharaoh or child of a pharaoh, something like that. There's an exhibit where you can see a spiral fracture down the femur. Okay, now I'm seeing this spiral fracture down the femur, which means that 5,000 years ago, someone knew how to set that. I'm a physician. I've learned how to set that, but I wouldn't do it unless there was no one else in the room to do it. It's very highly specialized. So what I'm telling you about osteopathic medicine, I don't want to give the wrong idea that 150 years ago someone decided how to manipulate it. People were manipulating in Egypt 5,000 years ago. Okay, and osteopathy is something that has blended these manipulations with modern medicine. Some things that are very common that people know, or we call HVLA, or the things that are crack on your neck and back. We do these types of manipulations. We do things that are soft that we call visceral or myofascial manipulations. We do things for your lymphatic system. Out of osteopathic medicine, not the European model, out of the American model, came a number of people who came up with a lot of medical contributions, not just manipulation. This gentleman here, I was at his 80th birthday about 20 years ago, so I don't know if he's still alive. He was not an osteopathic physician, but a PhD researcher working with Osteopathic College. His name is Kim Court. And he did a lot of work that was germane to axoplasmic flow in the 1950s. This lady here, Louisa Burns, did a lot of groundbreaking work on exchanges at the motor end plate in the early 20s and 30s. So there's a lot of interesting work, not just in manipulation, but manipulation with medicine. There's other types of techniques that came out. Chapman's reflexes were techniques based on viscosomatic reflexes, things that we use in medicine, McBurney's point and such, to diagnose visceral disease. Cranial concepts that came out, the word craniosacral manipulation is very popular today. Strap technique is a technique of very hard, heavy manipulation. Actually, I went to one of our meetings 10 or 15 years ago because they were going to talk about strap technique, and it was one of our old professors. This is who I learned a lot of great things from, old people. Old people who have been treating people for 30 years. They know a lot. And I sat in the lecture, I said, I wonder what strap technique is. That's going to be really interesting. Well, what it was the professor took a student and he strapped him in with a belt onto the table so that when he would manipulate him, he wouldn't fall off the table because it was so hard. That's not what I was thinking at all. So there's a wide variety of manipulations within osteopathy. Things that are very soft and things that are very aggressive. In the United States, osteopaths were on their own pathway until about around the time of the Second World War. During the Second World War, the United States needed more doctors. So they took the osteopaths and they said, well, you know, if you guys would start prescribing drugs, we think we can make you like the MDs. And that was good and it was bad. It's good because I am a fully licensed physician. I can do medicine and surgery, I'm trained. But my day is mostly manipulation. It's bad because most of the people that I went to school with today, they're surgeons, they're family doctors, they're delivering babies, they're psychiatrists, and not many do manipulation. In Europe, because they do not have medical training, they're doing only manipulation. But their training it's a lower understanding. Last year I flew maybe 350,000 kilometers. I'm an American born in Philadelphia. I now live in Thailand. So my son has my practice back in the United States, and I'm retired from practicing every day, except for lecturing, which I've been doing for many years. I've been to so many countries and seen so many things develop. I am very grateful for this opportunity here to speak to you now. These are things that we know, these are names that may not mean anything to you, because if you're not familiar with osteopathy, you may or may not have heard these types of techniques. Cranial manipulation, facilitated positional release, ligamentous articular release, functional technique, muscle energy technique, counterstrain visceral. These are common names. People have taken our manipulations, or manipulations we do as an osteopath, and they've broken it up into little pieces. And they say, I'm a guy who does this kind of manipulation. I'm a guy who does that kind of manipulation. I'm none of those guys. I'm a guy who does medicine. Our founder, Dr. Still, said that we should know the anatomy and the physiology and then create whatever technique it is that we need to use for the patient for this treatment. What I've seen is things have gotten, we say watered down when it becomes diluted to do only pieces of osteopathy. I want to share with you just a few photos. These are some great people I learned from. Bud Bernardi is 85 years old. If I asked him to speak at this microphone, he would panic. He couldn't give you the scientific terms anymore. But these people are where the knowledge is. They've been doing medicine, surgery, and manipulation. Phil Greenman, he's written all kinds of textbooks in the MD world as well. And this is how I learned to become what I am. Learning from the textbooks, studying medicine, studying surgery, but spending time with people who've been in the healing field for many, many years. At this time, especially, my wife is Kenyan. My wife is from a third world country where people are desperately poor. I do, what I do every year is I do a lot of work in rich places, Switzerland, Japan, all over Asia, and I do a fair amount of charity work in other countries where people don't have access to what we have in the United States. I think in Egypt people will benefit from manipulations, things where maybe you cannot afford the drugs that we're using. Many of the people I saw this weekend were giving me x-rays where I would have had an MRI in the United States. In the United States we have access to many, many things. To me it's much more important, I think, to be able to share with you here something that can be accessible to everyone. And that's manipulation. I'm happy to answer any questions you might have, and I'm very grateful for the opportunity, and shukran for listening to my speech.
Thank you for Dr. Sadat. Any questions?
Yes.
Dr. Hisham Ismail, Professor of Clinical Physiology. I would like to thank you for coming here. It's an honor to hear from you for this new, actually for myself, it's new for me, osteopathic medicine. Actually, I get confused a little bit about what I know before, which is orthopedic science. And now we are saying osteopathy. It's a term for me, for myself, divided by two things. Osteo is coming from bone, and pathy is coming from pathology. So, so it seems to me that you are going to do some pathological lesions to the bone. So I would like to clarify this term. This number one. Number two, what is the relations between this osteopathic term and the different types of orthopedic disease? For example, autoimmune disease, rheumatoids, fractures, osteoporosis. Okay?
Okay, the first part, osteopathy, osteopathic medicine. Osteopathy is just a terrible word because I went to medical school, and I'm going to give you the United States version. This is going to help clear it up. Osteopathy in the United States is regulated, just like medicine is here. I took state exams, I sat next to an MD, we had to pass the same exams, and then our hospital postgraduate training, internship, fellowship, residency, it's in an MD hospital. If you want to become a surgeon, you're together doing the same thing. So it is very confused, even in my country, especially if I do a manipulation to someone, and then they say, well, my family doctor says DO after the initials, and they don't do manipulation. How come? I can never answer that question for them. Why their other doctor won't do it or is not interested in it. So the term is just a bad term. It has nothing to do with bones or pathology. I can only guess that the founder wanted to give it a different name, and that's it. It's a bad name. Osteopathy, most of what you'll see in the United States, we're maybe 100,000 osteopaths in the United States, and maybe there's 1,000 or 1,500 that really do manipulation. It's the focus of their practice. It's a very small group. Outside the world, people like to confuse things on purpose. Okay, it is not medicine anywhere else. Okay, so that it is an undergraduate degree. It's non-medical, but people like to confuse this term. It is also it's not regulated in most of the world. Only in the United States. We're regulated. They're regulated in Britain to do manipulation. They're regulated in Belgium, France, now Germany, I believe. And the rest of the world, it's not. So there's people that are using that term based on some little bit of education, or I don't know what they're saying. So it is a bit of a scary term outside of the United States, what someone means by osteopathy. In my own country, my mother still doesn't know how to tell people what I do for a living. When I went to medical school, I don't come from a rich family. I come from an average family. And I got married, I had children, and I became poor right away. And I wanted to go to, I was in the karate business, that's what I did. This, Kung Fu? Yeah. Well, you can't raise a family on that. You can't pay your bills. So I went to medical school after I was already doing another profession. I couldn't pay my bills. I had my reasons were I wanted to be able to make money. And I'm not afraid to compete. So when I went to college, I got my 4-year degree in 2.5 years while working full-time. I graduated top of my college of 60,000 people because I never sleep and I'm afraid. So I work hard. So when I got to medical school, I said, I'm going to be a United States brain surgeon, plastic surgeon. They make money. And then I saw one of these old people, not a photo I showed you. And I saw him doing things with manipulation. And I said, you know, I want to do that. That's what I want to do. I was very interested in that. And I was at a meeting in Texas where I saw this demonstration. And I told my wife, and she's like, okay. And I called my mother, and I said, Mom, I'm going to do this. And there was a hesitation. She said, your father and I thought that after all of this aggravation, you were going to be a regular doctor. And I said, I am going to be a regular doctor, but I want to do manipulation. Then the real question came out. She said, well, what if we get sick? Who's going to take care of us? I said, I'm a regular doctor, and I take care of them anyway. And like family, they don't listen to me, they don't pay me, and they'll never go away. Family is the most impossible to work with. They won't follow your advice anyway. That's one part. The other part that you asked me was, how does it relate to diseases like rheumatic disease, osteoporosis? You mentioned something else. There are some things that we think of for manipulation. Back pain, neck pain, headache. The chiropractor, the physical therapist, the person who does massage, myself, people come to me and say, my back hurts, can you rub that and make that better? That's one. The other type of patient I see are people, medicine doesn't have an answer. And in osteopathy, there's not research to back this up, so I'm not going to even begin to tell you that we have double-blinded studies to show why people get better from some diseases. But I treat autistic kids. I treat kids that I've had a few that have been dead and resuscitated. Cerebral palsy. I had one child over the years, I had one child with, it was either Edwards syndrome or Patau syndrome, I forget which, a trisomy of chromosome 11 and 13. There's no protocol for doing manipulation for a trisomy of chromosome 11 of a child that won't survive the first year of life. But I've seen, as many of you, if you're in medicine long enough, you see miracles that occur. Not miracle from Steve Sadat, just trying to get their body processes as loose and relaxed so that their body can be well. That's my thinking. Because I've had autistic kids who have never spoken a word speak. Often, no. Once in a while, a kid who's never spoken, and their head is very tight, and I do some manipulations, a few treatments, and I've seen a change. Sometimes. I haven't made changes for diabetes, rheumatoid arthritis, but rheumatoid arthritis, let's take that one. Rheumatoid arthritis is not one thing. Am I going to correct the hands of someone whose hands are twisted? No, I'm not going to. But does that person sleep? Do they have other aches and pains associated with now having to use their hand a little differently? A person is a lot of things. They're not just one disease state. They're not just osteoporosis. They're someone who has other aches and strains. So very often there's an approach that can be soft for these people and maybe make a difference. And I know colleagues who will stand up and give the speech on curing cancer with manipulation, and it's not true. But sometimes you treat someone who has cancer and they get well. Sometimes people get well on their own. I believe, and my experience is that the human body was divinely created by God for us to be well. What I don't answer is why bad things happen to good people. It's not for me to answer. It's not in the realm of mankind. I just will do my best. So for almost any disease you can ask me, I can give you my anecdotal experience. If you have ringing in your ears, maybe 1 out of 5 I can help you. Ringing in your ears, having tinnitus in your ears, is usually idiopathic. So if there's some little nerve that's bound up, maybe I can help. For genetic diseases, which Dr. Hamdi Amara asked me about, and I said, boy, you're really picking a tough one here. Because I really wish I could give you a bunch of studies and say, this study's associated with that. But our profession has been very poor about it. Our profession in the United States is essentially MD medicine. So, I mean, when I got to school, Pfizer gave us our stethoscope. That was the first gift. Okay, and then, the other drug companies take us to dinner and tell us how to prescribe. And I do write medicines. And I do send people to neurology, and I send people to surgery. I don't tell them this is the one store to come to. So it's a difficult question, and I don't want to give you false answer. Correlations between this and this disease state. Last point, and there was one more question, is osteopathic medicine it's a science, but it's blended with art. Because I can tell you about touching and pushing and pulling, but it matters who's touching and who's pushing and who's pulling. Okay? It's like having a set of colors here. We can all know the colors and throw it on the wall. Some people it's art, and some people it's not. So there's an artistic sense to having palpation. And to study that I'm not a researcher. I'm not the guy for that. Does that sort of answer your question? Yeah.
Actually, this is very good. This is for me. It's very exciting to hear about this science. But it's your answer clarified many of my questions. But I would like to concentrate actually on the principle of this principle. As you told now, that if you get a patient and he needs to be referred to some surgeon or orthopedics, or you refer.
Yes.
So this is the end of the principle, of your principle. So can you tell us very brief about the principle of these techniques, the principle?
The shortest answer for the principle of these techniques is to restore normal structure to the body. Sometimes we can't restore normal structure. You've had a kidney removed and the structure is not normal. But you may have fascial restriction or adhesions. Or you had another type of laparoscopic surgery and the surgery went well. The patient says, I have these pains. We try and, in a one-word sentence, bring the body tissues to a state of relaxation. How? Soft touching, hard touching. It's a longer conversation, the how. Okay, if your back hurts, I'll give you more of an answer. Okay, if your back hurts and I rub the muscles, maybe that works for you for half an hour, and then you go home and you still have your back pain again. So there's other ways to touch.
لو سمحت ننظم بس شوي. دكتور جمال.
Okay, if this isn't going to reach, I don't think.
حاضر يا دكتور. جمال.
I don't know if it'll reach.
No,
you.
you can ask.
We can
Yes,
hear
yes.
it.
Okay.
About the professional works, like for example, university professor, are there specific affections or diseases is connected to this profession?
There are things that are more amenable to manipulation, and they will be back pain, neck pain, headache, but pneumonia, asthma, COPD, chronic obstructive pulmonary edema, okay, respiratory ailments. There's manipulations we can do to increase your tidal volume. I can do things to you that will increase your tidal volume at the end of that treatment and have some lasting effect. How long lasting? I can't tell you, but there's things we can do to directly increase your oxygenation.
What about cancer?
Here's my answer on cancer. I've treated so many cancer patients. There's no studies. Let me give you that one. Nothing, okay, to support altering the course of someone's cancer. But you will give them palliation. And palliation is important if it's your 6 months to live or it's your 2 months to live. And I've gotten a lot of those patients. They're at the end. Can you do something for me? I'm not sleeping well. In a scientific sense, I don't mean this in negative, but in a scientific sense, we can't do anything for you. In a human sense, it's your 6 months, it's your 2 months, it's your father who can't sleep. And I see a lot of these patients for palliation. Okay. Yes?
Is it related to paramedicine, Chinese medicine, or sleeping medicine?
It's not related to Chinese medicine. No, it's not related to Chinese medicine. Osteopathy is not the only one who's doing manipulations to try and make people well. There's chiropractic, does a lot of the hard type of manipulation. Some of that is very similar to what we do. When osteopathy is practiced, like I do, and I know medicine, I know surgery, and I refer when I need help, it's practiced very differently. Chinese medicine have a completely different... China is not part of our universe. It's a different place. And their thinking on human disease is very different. I don't do Chinese medicine, but a lot of my friends do.
Paramedicines. Paramedicals.
Paramedical?
Paramedicals. And here in Egypt, some people use the paramedicine.
Like complementary medicine?
Like physical therapy or something.
It's not physical therapy.
Pain relief and.
Osteopathic medicine in the United States is not a paramedical specialty. It's a medical specialty. So I send people to a physical therapist because I don't have time in my office to do range of motion or increased strength. But my view is not, my view is a medical view, a complete view. I had a patient who was a C4 cord compression for 2 years who couldn't walk for 6 years. I got him out of the chair in about 6 weeks, got him walking. And I sent him to physical therapy to do a little bit of range of motion. What they did was they got someone who was previously in a wheelchair for 6 years to deadlift about 70 kilos until he tore his hamstring muscles. Because the way, at least in the United States, the way physical therapy measures results is range of motion and strength. That's because that's the way they get paid. If they can't show these markers, they don't get paid. So no, it's not physical therapy, it's not allied health. Yeah.
For example, for headaches or so, what kind of manipulation?
I'd have to lay you down and show you. It's very soft what I do. I've seen people with hemiplegic headaches. One person with paraplegic headaches and various migraine headaches. These are people who are very amenable to soft types of manipulations to make it, change it, make it go away. In my country, people are using neuroleptics like they use candy. Okay, that's the new candy for headaches, is giving you neuroleptics until you go into a, if you use enough neuroleptics, your pain will go away and so will your life. you'll go right to sleep. So I've gotten people off medicines. Clustered headaches has been much more difficult to treat, but I've been able to treat some people with cluster headaches.
دكتور منال
Okay. One more question? Yes.
ناصر دكتور منال
Is it related to it? I think we are all asking the same question to understand what is this. So is it related to the energy that you are activating in the patient, or your energy, or is it
Okay, perfect
away
question.
from energy?
This is a perfect last question. Yes. Thank you. Okay, no, I'm just kidding. No, let me give you the whole answer.
Your manipulation is activating the healing energy?
Let me give you a full answer, and this will be the last question. My profession, if I go back to my medical meetings in the United States, there are many, many people that want us to forget about manipulation because of the question you just asked me about energy, healing the patient. Okay. In one of our textbooks for the type of manipulation I do, one of the people who wrote this textbook is he was doing research in the 1930s, and it was work on the head. He's talking about the cerebral spinal fluid, okay? William Garner Sutherland. He said, God is in the cerebral spinal fluid. In the editions of that book we now look in, it's missing. God's not there anymore. Okay, this is what they want is a secular, non-spiritual view of things. And when you start talking about manipulation and energy and healing, there's a lot of people in my profession do not want you to use that word. But I believe in God. I believe all healing comes from God, all life. If not for God's will, second to second, none of us would be here. Having said that, there's an energy. There's me, there's the patient, and there's me plus the patient. That's why it makes a difference who is doing the manipulation. I may do a manipulation to you, and God willing, I will help you. Okay, but it matters me and it matters you, and it's between you and Allah whether or not you're going to live or die. That's not my role. My role is to honestly do what I can do to help you. So I believe that there are things that we can do. Your neck is tight, and I go like that. Now it moves. But you have cancer, we don't do that. You have attention deficit disorder, we don't do that. There's some other caring that happens between you and the patient that I believe gets transmitted between you and them. And I believe it is an energy because you are a roadmap for your physical body, your emotional self, and I believe your spiritual self. You are all of these things. It's far too complicated for me to understand. I believe and I pray that God will heal you, and I'll do what I can do to help you. And this is why it's difficult to study. This is why it's difficult to prove.
Some advice.
اوكي دكتور
Some advice.
دكتور جنب الطبع معلش انا اسف ده سالت له سنه دكتور
Please, when a backache patient come to you, you give a drug or physical therapy.
What kind of patient?
Backache.
Okay, let me answer. If you come into my office and you're crying and you're in tears and you can't stand up straight and you have a herniated disc, I'm going to manipulate you. I'm going to give you some narcotic so that you can go to sleep tonight, and I'm going to see you on follow-up. And if you've already been referred to a neurologist or a neurosurgeon, you're going to keep that appointment. If you come and your pain is not as bad, I'm going to manipulate you, maybe give you some non-steroidal to help keep the inflammation down. While I'm working, I may give you some Flexeril to help keep some muscle spasm down for a few of my treatments. And that's what I'm going to do. I'm not going to leave you go home in tears. We learn things in school, how bad narcotics are. No, they're not. They're not bad if you have cancer and you're dying. If you can't sleep tonight. If you can't sleep, all your problems are worse. Am I making people drug addicts? Absolutely I'm not. Absolutely I'm not. I'm sending them to the physical therapist very rarely. It's usually their other family doctor who's doing that, and I usually don't want them to go to the physical therapist because of the man I just told you. They had him deadlift, enough weight until he ripped his muscles. They are far less specific than I am. So there's a variety of things. There isn't the back pain patient. There's you and how you are that day, and what I suspect medically. If I suspect medically there's some other ghost here that I'm missing, I'm sending you to the other doctors. But there is not the team of doctors that we're all talking to each other. We have a lot of patients that have, they're having secondary problems because they're on so many drugs because they go to several doctors. And I'm the one who gets the list of drugs. I'm like, well, how did we get from here to here? And when I ask the patient, I say, are you taking any medicine? And when they go like this, they reach for their wallet, that means a big piece of paper is coming out. It means they're not on one or two things.
Okay. Dr. Osama?
Thank you, sir.
Yes, sir.
Wonderful lecture and very amazing. My question is the use of stem cell therapy. The difference between your program and stem cell. Which one of these is more
Stem cells is more of a governmental issue in our country. You know, under one of our presidents, he was very much against it. Our president now is for it. So this is something that's happening at the university level. It's not happening at the practitioner level. I believe, and I may be wrong on this to speak about stem cells, but I believe the issue is taking stem cells from however it is they're getting them from fetuses, because people are using stem cells in the United States. It's a question of where they're getting it from and whether or not government funding is going for it. But it's a political answer that I would be the wrong person to tell you. They are doing it, but they're not doing it probably to the level that other countries are. Yes?
Dr. Sabat?
Thanks a lot for your nice talk. Thanks a lot for you are always remember God. My question, not question. Can you give us some advice to increase to get the best quality of life?
Can I give you advice?
Through your life.
Can I give you advice to get the best quality of life?
Yes.
I can. Here's my advice. Find something to laugh about each day. Find something to smile about each day. You cannot say to yourself, I will be happy when, because that day will never come. So I've been through various trials and tribulations in my life that have led me to be this way. If you don't find something to enjoy today, your family, your prayer, your work, every day's not a party here. If it was, this would be heaven. Wouldn't be Sadat City. But maybe Sadat City is the first step to heaven, so I don't want to get in trouble. But you know, you need to find you need to be happy to be healthy. That's what I think. Forget osteopathy. Forget osteopathy. You need to be happy to be healthy.
Yes, I hope so.
That's what I laugh. You know, find something fun to do today. It's a large question. It won't be osteopathy. It'll be your state of mind, enjoying your family, finding fun where you can find it. That's what's going to help you today. I know lots of rich people that are miserable. I'd like to have the money part without the miserable part, but it seems to go together with these people because they're worried about every penny. That's the best I can give you for that answer. Yes, sir.
Okay, Dr. Hisham عاوز كومنت سريع.
كومنت بس.
Yes. Okay. All right.
Actually, I would like to thank you for your answer on the questions, and also to continue to understand our behavior and our questions. All of our colleagues are working in the evidence-based science. And until now, I think you noticed that we didn't get from the last question even a frame of the science. Maybe it is because it's a new science. Nowadays, I think you heard about some new inventions about something related to treatment and diagnosis of HCV.
Yes.
All the media and all of us.
Is this what we saw in the news the other night?
Yes,
okay.
all of us are talking about this. We don't know the principle. They claim that they cure the virus by hepatitis C and HIV, even HIV.
Yeah.
Okay, maybe they are right, but we need an evidence. So, your science or your
Your technique.
flag of science now may be curable, but I think if it is ended by evidence, for example, you are treating patients with cancer by something. You know how to diagnose that it is curable. If you are treating something of headache, and it's not relapsing. So this is a curable case,
Yes.
like this. So I think finally, if you have something published already about this and ended by curable cases, we are very appreciated if you tell us about this.
Okay, I'm giving you the answer. In my profession, there's plenty of things published by DOs about medicine and surgery. About manipulation, you're not going to find it. I'm personally not responsible for the lack of research. I'm not a researcher. I agree with you, okay? I agree with you that needs to be done. But I will pass that advice on to younger people, because it will never be me.
We can cooperate with you.
No, you can, yes. No, absolutely.
The team here.
I would be happy to cooperate with you, but I don't have anybody standing behind me in America. The studies that I have seen have been N equals 12. This is not a study, okay? If you have 12 or 20 participants in your study, this proves nothing. To come up against the drug world, to have a Class A study and have 500 people cohort study and follow something for a number of years, okay? That requires a university and it requires real standards. Me, I will be happy to cooperate with you, but I don't have anything to give you from the profession because it is woefully lacking in that and full of anecdotal stories of wellness. But if your back hurts, I'd be glad to help you.
Okay. I would like to thank Dr. Stephen for his lecture. And actually, when I met Dr. Stephen in Cairo, and he talked to me and he told me about that wave treatment, it was something new to me. It was a new, but now I think that it is a new for all of my colleagues here, and we still, that is the science. We still know a bit more, and I think we can find any sort of cooperation between you and Dr. Stephen in the future, inshallah. Thank you, Dr. Inshallah. Thank you.
Shukran.